Aye.
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 Opposed, no. That motion carries unanimously. Next, on to operational functions. Item 6A1, claim disallowance, Mercedes Homes. And Supervisor Hart has joined us, so all members are present.
Hello. We received a claim on December 5th from Mercedes Homes relating to the death of her child, Zaylin Burnett, who was, I believe, 3 years old and placed in a treatment foster care home by the Marathon County Department of Social Services. The treatment foster home was licensed through another agency and was located in Dunn County. The child passed away. It was determined to be natural causes. There were, through law enforcement investigations, social service investigations, there was no wrongdoing found. And so based on an evaluation of the initial circumstances and then from WMIC, as a result of Ms. Holmes' claim at this time, the recommendation is that there's no liability on the part of Marathon County. And outside counsel has requested that we issue a formal disallowance regarding that claim at this time.
Are there any questions? Any questions? If not, what are your wishes? Chair Gibbs.
Thank you, Mr. Chairman. I'll make a motion to disallow the claim of Mercedes Homes in conjunction with the recommendation from our insurance carrier.
Is there a second? Is there a second by Supervisor Limmer? Any discussion on the claim disallowance? If not, all those in favor of the claim disallowance will signify by saying aye.
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 Opposed, no. That motion carries.
Thank you.
Next is consideration to set revised property value for parcels 29, 12, 90, 72, 53, 03, 54, and 29, 12, 90, 70, or 73, 51, 0, 115 for purposes of public auction.
Thank you, Mr. Chair. Per the memo that was in your packet with all the pertinent information for these two parcels, they've both been listed on Wisconsin Surplus twice with failed attempts to sell them, with the bids not reaching the appraised value either time. The one parcel they were both very close. So I would just, per our ordinance, request a revaluation of those parcels so that we can get them listed again with our next batch that we have going to Wisconsin Surplus next week. So for the parcel on McClellan Street, I requested a value of $9,000. And for the parcel on South 3rd Avenue, a bid of, or a value of $7,500.
Are there any questions? All right, what are the wishes of the committee? Chair Gibbs?
Thank you, Mr. Chairman. I'll make a motion to set a revised minimum sale price on the 529 McClellan Street to $9,000 and the 738 South 3rd Avenue parcel to $7,500.
Is there a second? Supervisor Lemmer seconds. Any discussion? If not, all those in favor will signify by saying aye.
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 Opposed, no. That motion carries unanimously. I just have a quick question because in one case there was a error in the bidding. So those
Yes.
people get kicked out of the system?
They are marked as non-pay and they are not allowed to bid on future Wisconsin Surplus auctions.
And do we have that often?
No. When I talked to staff down there, it was very rare. But this was kind of a bizarre situation. So she said they needed to be marked as non-pay.
All right. Next is item 6B1, resolution to approve carry forward funds. Is it Sam?
Good afternoon. In the packet is the resolution R20-2026. These are program revenues. These are projects that are going over multiple years, and there are restricted funds that were not budgeted for in 2026 that the request is asking to move that, to carry these funds over. In there, outside of those, I guess, 4 different reasons is veterans. The veterans relief, we're looking to take the excess that was in their 2025 budget and use that to replenish the veterans relief funds. Statutorily, they can ask for levy for it. They haven't for quite some time, but they have exhausted all funds that were in there. This right here would probably give them about 3 years of funding, depending on need and past usage.
Any questions? Chair Gibbs.
Just a question on that Veterans Relief Fund. Does the Veteran Service Officer then have full discretion over dispensing those funds?
I can take that one. There's a Veteran Service Commission that is comprised of 3 residents per statute. So the board approves those appointments to that commission. They consider submissions from Marathon County residents for access to those veteran relief funds. Our longstanding practice has been to work to link those veterans and their respective requests with local organizations that do support veterans. So whether it's the Elks, the Man of Honor, the various local organizations. But there are occasions where that Veteran Service Commission fund the request is considered by the Service Commission. The Veteran Service Officer staffs that commission, and then they make awards consistent with state statute following those requests. So things like if someone had a request for rent, they needed first month's rent or paid past due utilities are some of the things that, as I understand it, those requests come in for.
Thank you.
Any other questions?
Mr. Chair, I have a question.
Go ahead, Vice Chair.
What is the the rejected for the Register of Deeds? What program is that related to?
So the redacted records, there are some statutes around the fee that was collected for it. It can only be used in redaction efforts. There again, if you look at our fund balance, it would sit in a restricted fund balance, meaning it cannot, there are statutes that guide how we can use that. It was before my time, so I don't have a lot of extra information beyond that. But they used it in 2026 to purchase like a new redacting software. And it's been there for quite some time.
Do you know, as a follow-up?
Thank you.
Do you know, is this part of that, I know the judges can request that information not be made available. Is this how that redaction, those funds would be used?
I think you're referring to the Judicial Privacy Act.
Right.
I don't believe those things are linked in any way, but we can have at a future meeting when we have an update from the Register of Deeds, perhaps I can talk to Register of Deeds Jenny Lemmer and we can look at what that fund has been used for in the past. And I think Vice Chair Marshall brings up a good point, like look to better understand what the utilization is and what we could potentially use it for moving forward.
If as part of that, if you could ask, if this is a legacy fund that was created for a purpose and we're not allocating them, perhaps part of the discussion could be, what steps would we go through to get those funds released or repurposed, if there would be a process?
Certainly, we can look at that.
Any other questions?
Just one additional note, on the administration special projects carryover, please note out of that $142,731.39, there is $75,000 in there that was a part of the 2026 budget that was approved for the homelessness contract. So the difference between that is $67,000 that would be of a new request. But I did combine both of those numbers together on this request.
All right, are there any other questions? If not, what are the wishes of the committee? Chair Gibbs?
Make a motion to approve the resolution R 20-26 on the carry forwards to the 2026 carryover.
Is there a second? Second by Supervisor Hart. Beat you to it, Scott. So any discussion on the motion? If not, all those in favor will signify by saying aye.
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 Aye. Opposed, no. That motion carries. Resolution to amend the capital assets threshold policy. Sam?
Back in 2006, the GFOA, or the Government Finance Officers Association, published some guiding, or some guidance on creating policies for capitalization thresholds. What a capitalization threshold is the dollar amount of which you will expense it versus putting it on the books as a capital asset and depreciating it. Around that time, a lot of organizations went ahead and followed the guidance. In there, it says a minimum of 5,000, of which we also followed. There's a minimum of 5,000 for general assets and 50,000 for infrastructure. So when you think of things like roads, bridges, stuff like that. It's been 5,000 since then. We looked at increasing that back in 2022, but never went through with the full process. So I'm bringing it back for consideration in a resolution format to move it from 5,000 to 10,000.
Are there any questions? Any questions? If not, what are your wishes? Supervisor Hart?
Make a motion to approve the resolution, move it to the full county board.
We have a motion to approve the capital asset threshold policy amendment. Is there a second? Seconded by Chair Gibbs. Any discussion on that motion? If not, all those in favor will signify by saying aye.
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 Opposed, no. That motion carries unanimously. Move on to educational items. 7A, introduction of healthcare consultants, National Insurance Services. And Candace, you're gonna?
Okay. So as you all are aware, we completed our RFP for healthcare consulting services, and NIS was chosen to, was awarded that RFP, was awarded that bid. And so what we had talked about and discussed was that you would see them more often, that you would get different reporting and promote understanding of our process and get some feedback on, you know, the way we're moving in order to develop a long-term healthcare strategy as a county. And so today we have our NIS representatives, and so they're just going to introduce themselves and tell you a little bit about what they do.
Okay. Thank you very much, Candace. Appreciate it. Committee Chair Robinson and members of the committee, as well as county administration, thank you for having myself and my colleague, Jordan Stanley, join you this afternoon. So we just wanted to provide a brief introduction to our National Insurance Services team and give you a little bit of background on us, and then give you some insight and line of sight as to what we're going to be working with the county administration on as we continue on in 2006 and beyond. So for National Insurance Services, we are an organization that is specialized in the public sector. 98 to 99% of all of our clients are in the public sector, whether they be municipalities or public schools, cities, counties, hospitals, technical colleges, that type of thing. So we understand the public sector marketplace. That's our sole sole purpose is really serving the public sector. We take a collaborative approach, and specifically here for Marathon County, we have a team of 5. 2 of us are here this afternoon. Myself, I've got 28 years of experience working in the benefits consulting arena, a wide range of medical funding arrangements or models, fully insured, self-insured, level funded, as well as pooled plans. Quite a bit of experience with stop-loss insurance, as well as pharmacy benefit management oversight. And the other folks that are on our team, and I'll let Jordan introduce herself here in a second, that are not here today, we've got Perry Guilfoyle. He's our Director of Plan Analytics, so he does all of our renewals and modeling on behalf of Marathon County. And then we have Zach Cunningham, who is in our office and performs kind of a supportive role for not only county administration on an as-needed basis for HR, but also individual employees or members of the plan as they need assistance with whatever they've got going on, regardless of the benefit that they need. So we've got that out there. And then we've got Adam Cook, who runs what we call our retirement income division. So really to help in any type of defined contribution environment, 457, those types of things, tax advantage plans, HSAs, VIBAs, health reimbursement arrangements in that thing. And then the most important part is the account management piece, and that's the day-to-day operations with the county administrative team and HR team, and that is Jordan Stanley, so I'll let her kind of explain herself here.
Hi, thanks for having us today. I'm Jordan Stanley. I've been with NIS for 2 years, but my previous experience is all in the public sector. So working at a city and a county for years in the HR department, specifically dealing with benefits. So I appreciate the county side of things and now getting to see it from the other side as well, being able to kind of align the 2 perspectives as we work together.
Okay, thank you, Jordan. So just a couple things before I open it up for questions. We've really been focused as we began our engagement with the county admin team on really identifying a couple key components. First and foremost, we do have a near-site clinic that we're engaged with, the Estia Clinic. We actually had a very positive working meeting prior to this meeting here today, so that was very good. We're in the process of evaluating data. How can we improve the doors for our membership getting into the clinic because we're trying to remove claims off of our fully insured plan. So we're working with them, really trying to identify and articulate a return on investment on that as we have a county commitment on the purchase of services for that, and then through our existing medical carrier. So kind of a partnership there, so to speak. And then also evaluating our existing model, our funding model relative to our medical insurance. Really just evaluating fully insured, self-insured, level funded plan. What is the best model for the county on a go-forward basis? So really that's just an evaluation process. There is no silver bullet. There's no pre-existing determination there. Really, it's just a market search and kind of figuring out where the value lies in terms of the cost. So that is going to be a project for us in 2026. And then really, as Candace mentioned, what is our role being in front of the HR and Finance Committee? What we really want to do is after working with the county administration and the HR team, bring forth kind of what we're looking at from a strategic plan perspective so that you're not guessing and that you know. So we really want to open up that line of communication with the board and be fully transparent on kind of what we're operating with and what our goals are and our objectives. So as I mentioned earlier, we're extremely collaborative, not only with our existing vendor partners, but certainly with the HR team. So we work with them on really on an as-needed basis, whether it be day-to-day, week-to-week, or month-to-month. And we did also have an earlier meeting with them as well, the HR team, and that went very well. So we're continuing to engage there and work towards solidifying the data. We're very data-driven, and as we get our models up and running, we'll be sharing that not only with the county administrative team, but then as needed and as directed with the board. So we want to say thank you very much for the opportunity to work with the county. We don't take it for granted, and we just want to thank you, and we're looking forward to working on behalf of the members and the taxpayers. I'll open up for any questions.
Are there any questions? I'm sure that Vice Chair Marshall has some, so.
Thank you, Mr. Chair. I know that Marathon County contributes $30,739 to a family plan according to our 2026 budget. What are the per member costs in other large employers in our county or cities and villages nearby?
Yeah, so Vice Chair Marshall, I don't have that information in front of me this afternoon, but that's certainly something that we could find. We are in the process, and I did communicate earlier today with our county administrative team in our meeting that we are having access to some tools that are going to allow us to not only pull in public sector information, but as well as private sector. So I still have to yet get that access to that program, but once we do, we'll certainly share it with the county administrative team and be able to provide that.
Thank you. And follow-up question is, one of the big drivers of health insurance is emergency room use when perhaps a after-hours illness could be handled by urgent care. What strategies do you have to make sure people are using the appropriate level of service?
Yeah, I can appreciate that question, Vice Chair Marshall. So we actually have a virtual tool available to all of our members that are on the medical plan today. It's called Teladoc. And what we really need to do is ensure that we're messaging out to all of our members, not only our employees, but also our dependents, so that they understand that that is available to them for a non-emergent engagement. So if we can have people go to either our near-site clinic that I mentioned earlier in a non-emergent environment, that's going to go ahead and reduce some costs, as well as access the tools that are available today, and that's a virtual environment. We've seen a very successful outcome once employees, including our dependents, understand that this is available to them at no cost to them, because we are on a capitated program through GHT, our existing medical provider. Once they understand how that relationship impacts potential future impact to pay relative to our renewals, people generally kind of line up to be able to check out that service. So it's an ongoing education, but we do have the virtual environment as well as the clinic system, and then really just showing folks the numbers and saying, hey, I think data is really important in that situation. If we're able to show folks out of the total number of emergency visits that we've had, 35% of them were essentially non-emergent, and then show them the differences in the cost. And again, if we're all working and rowing in the same direction, we're going to have a better outcome when it comes time to renewal. So we have those tools, and we just need to educate further on that.
Chair Gibbs.
Thank you, Mr. Chairman. So a couple of things, and I think you alluded to it a little bit, is critical to our renewals is utilization of our on-site clinic and getting that utilization up and showing the benefits to the employees that there's less cost to them and less cost to the county. What evaluation process do you use when you start to look at evaluating self-insured versus fully insured versus group insured for the long-term benefit of the county and the members? Because I think implied is the cost is high at $32,000 for family, but it also is more plan specific, and it's also dependent upon the group. So every group is unique in what they're rating. So when we try to compare, say, Marathon County to the city of Wausau or to a private entity or private industry, they may not be comparable because you don't have the same experience level of employees.
Yeah, that's absolutely correct, Chair Gibbs, and then Committee Chair Robinson. I would say that there's a couple things in there. What I would say first and foremost is that when we compare, we need to be very specific on what we're comparing. So draw the differences between plans. Sometimes we'll have access, sometimes we won't have access to certain data points such as demographics, There's certain industries that are from an underwriting perspective, more risky and or less risky. So we want to factor that in, but overall, I think it's good to see kind of in general where we're at, because most folks like to begin with a comparison that's easy to understand, and then we can kind of peel back the onion, so to speak. So we absolutely do that, and we'll pull the data for that. To go to your other question regarding how do we do the evaluation, really that's going to be market driven. So we will eventually put together a request for proposal outlining our specific census, our specific data over the last 24 months, both medical and pharmaceutical. We'll let them, we'll paint the picture, so to speak, in our RFP regarding this is what the cost mitigation strategies that we've deployed thus far. And then it really just is going to come back to how are those underwriters or stop loss providers or pharmacy benefit managers, how are they feeling with their models on our particular risk? Once they do that, we pull that in and we do a comparison between fully insured and self-insured. And really what that is that's just an evaluation of risk. And then how much are we, or do we feel would support, it would be appropriate for the county in the evaluation process. So we've got 3 different models that we use for that to help kind of gauge our evaluation process in those different models. There's no doubt that in my experience, and again, I don't believe self-insurance is the silver bullet, but it's absolutely one with our size and kind of where we are that we should be evaluating, again, with no preconceived ideas of what that result might be. But I would say that the tools that we've already we're utilizing today, as I mentioned, the virtual care and then the on-site clinic, those are great things for our members. And I actually do believe, as we're kind of evaluating, and we had a really good meeting this afternoon, I think are going to lead us to a positive return on an investment as we can continue to evaluate. But we get bigger bang for our buck when we're in a self-insured plan, because right now we may be lowering overall costs, but we're in a fully insured environment. So yes, it's a good thing for our members, but if we were in a self-insured environment, we would be removing that claim 100% from our overall claims cost, as opposed to a percentage savings within our existing claims costs. So those are the things that we're going to be looking for and evaluating on an ongoing basis.
Just a follow-up.
Go ahead.
Thank you for that, but it all comes down to risk tolerance. I mean, self-insured, there's risk, obviously, you can mitigate some of that risk with, reinsurance.
Correct.
However, reinsurance also comes at an expense. And then if you get claims history that is, significant, that reinsurance rate will continue to escalate. And we've seen throughout, as claims have continued to escalate, we've seen lasers used as tools to try to minimize cost, and that then falls back to this full self-insured when your reinsurance is lasering individuals.
Yeah, nothing that you said is inaccurate. I mean, it's absolutely, you've got a good understanding of kind of where we're at in the market. And there's no doubt, when we take a look at not only what's happening in the state of Wisconsin, as well as the Midwest in general, and even nationally, we've seen an uptick in high-cost claimants, not only in terms of the frequency, but also the severity. And really where that has negatively impacted plans on a go-forward basis is in that reinsurance and on the renewal. So, if we look back in the rearview mirror, we were maybe looking at reinsurance renewals in the high teens, low 20s, and now we're literally seeing a doubling of those, that reinsurance market. So we've got tools and mechanisms to evaluate that risk, and certainly we're very keenly aware of the fixed costs associated with that. Oftentimes what we do, and generally in the public sector, we really steer away from lasers because of the I think the perception and the reality of being a public entity. And we've been successful in doing that historically. But, you know, we evaluate all of those things as we do it, and then certainly we will vet that with the county administrative team, you know, Lance and Candace and Molly, and then based on what we're finding, ultimately bring a recommendation and or some information back to the committee and the board.
Okay, thank you.
So when I look at healthcare costs, you look at what's driving it, and part of it is design, which we've sort of touched on, utilization, and then your cost/charges. How would you approach each of those areas as you're going out and looking to our benefit package in the future?
Yes, so that's a great question, Community Chair Robinson. I would say we look at it in its entirety. Not, you know, those aren't mutually exclusive because it's part of an overall plan. So when we're doing our evaluation, we focus kind of where the fish are, and that's our claims utilization, number one. And a big part of that is pharmacy utilization. Pharmacy utilization continues to be the largest cost driver within any plan, and it's growing the fastest based on pharmacy trend. So we take a look at that. We deploy to the extent that we can and have access to strategies to go ahead and mitigate some of that cost. And then we concentrate on high-cost claimants as well as a stop loss in terms of what we can do. And plan design ultimately is important too. And there's a fine line with plan design. Oftentimes when folks look at plan design, the thought process is just let's go ahead and increase the deductible or the out-of-pocket maximums. And really all that is a cost shift. So when we just need to be very diligent and intentional on how we evaluate those plans, because in an environment where literally, you know, on average, we're churning through 15 new hires a month, and I just got that data, so I'm able to use it. We're in a situation where we need to, as a county, be able to effectively attract and retain our folks. And certainly there's more to it than just that on the medical side, but benefits is a big consideration these days. So, you know, we're trying to balance that. So we take a look at all of those categories when we're going out, and we have those discussions with county administration before we prep the request for proposal specifically for plan design considerations and or alternatives.
Any other questions? So as part of this increased transparency in communication, and maybe this is a question to both you and Candace, is that what sort of frequency would you look at coming to this committee to giving us updates on and types of updates?
I would say that is based on the committee's desire and communication with the administrator. However we are directed to proceed, we will do so.
And
Prepare for the annual meeting and my discussions with GHT, and whether it's negative or.
no, I would say it's positive. You know, it's a good evaluation is never a bad thing, right? And so again, we're coming in with no preconceived outcomes here. You know, we're at the county administration's direction, so we'll present as frequently as needed. Typically in an environment like this, just kind of a benchmark, generally maybe quarterly or biannually, we typically meet.
So one of the things that this committee will be working on is budget assumptions going forward that we take to the county board in early summer as part of the budget development process. So I would expect that we would have some sort of update prior to that so we can build that into the development of those budget assumptions.
Yeah, absolutely. What we'll do is we will provide kind of a snapshot of how we're running in terms of our overall experience. And we do that in a couple different ways. Number one, we take a running 24-month data set. So it's rolling actually. So when a new month comes on, the old month falls away, 24 months. And the reason we do that is that all underwriters and stop loss providers are looking at 24 months of data. We'll run it through our medical loss ratio calculator. And then we go a step further. We make an assumption on if we were to renew today, what would that renewal look like? The the further you are away from your actual renewal, the more medical trend or medical inflation we have to build into the formula. So we just, we take that with a grain of salt, but it really does give us an overall, and the county, an overall picture of how we're running. So I think they'll be able to kind of come with a range to the committee and the board on kind of what they're anticipating.
Other questions?
One last question, Mr. Chair.
Go ahead.
Do you have relationships or suggest relationships with surgery centers that have an all-inclusive one, like a hip replacement will cost me $25,000, all-inclusive of the surgery, the operating room, any follow-up visits, like the Oklahoma Surgery Center?
Yeah, so Vice Chair Marshall, we do. And it's not necessarily a specific surgery center. It's more of it's inclusive of multiple providers. And actually it's more so located on the central to western part of Wisconsin. But those are things that we are not opposed to. I have two of my largest self-funded groups actually participating in that type of arrangement. And so far, we've seen a very significant savings. So we don't have that relationship with any organization within Marathon County today, but that doesn't mean that we're not opposed to that and or evaluating that on a go-forward basis.
All right, any other questions? If not, we welcome you to our team of trying to control our healthcare costs and appreciate your understanding of the value of that from a retention and attraction perspective. And we look forward to working with you and seeing you on a regular basis.
Excellent. Well, thank you very much, Committee Chair Robinson and members of the committee. Appreciate it. Thank you for having us today.
All right. Item B is unaudited 2025 year-end fiscal update. Sam.
Thank you. In the packet, you'll notice that there are the year-to-date budgets. They're progressive, so that's where they were at the time that I printed them. There are still year-end closing processes going. I do intend on kind of touching and highlighting the departments and letting you know what's coming up and what can change in each one of those for 2025. So first, looking at non-departmental, you'll notice that we have miscellaneous revenue of $15,000 in there. That's from a annual amount that we receive from WCA for PFA or PFM for being part of it. All of the interest income for the general fund was recorded there, so you'll see a substantial amount in there. We did have transfers out that need to be recorded yet. Of that, $647,209 will be transferred to the debt service as part of the budget of 2025, and then $6,863,934 will be transferred to CIP, and then $150,000 of the interest revenue will be transferred to the debt service fund. The rest of the amounts in that revenue category are carryover funds that were budgeted and approved. In the county administrator, we do have a carryover request that was brought earlier of that $142,000, of which $75,000 was the homeless, 67 were projects in process. Yet to be accounted for in that budget under the revenues is an internal service charge. Clerk of courts, they had some additional state funding outside of the budgeted amount.
So could I just stop and just ask a generic question? Because
Please do.
You've got the actual PY year-to-date.
Yes.
Tell me what that is.
Absolutely, thank you. So going to kind of you're talking about this report, right? Thank you. So when you go in there, the amended budget is the approved budget plus any amendments that were approved throughout the year. The actual year-to-date is that next column. Then the budget remaining is just the amended budget minus the actual year-to-date. The percent used is the actuals divided by the amendment budget. And then the actuals prior year-to-date. That column there, depending on when this report is ran, so if you look up in the upper left-hand corner, you'll see that the period says FY, which stands for fiscal year 2025 December. When we look at the actuals year-to-date and the actuals prior year-to-date columns, that's meant to give you a representative based on last year where we were at that point. So this shows you December of 2024 in that column. If this report was ran through June, it would show you June in both the year-to-date column and the prior year-to-date column.
The prior year-to-date, the audited amount?
Correct. That was where we closed out last year.
Sorry for the interruption.
No.
I thought it
that-
was just important for everybody to understand what the columns were.
Thank you. Clerk of Courts, yet to be accounted for in their department is the $10,000 contingency non-lapsing account. Based on their performance as it sits here, again, unaudited, they should be able to sufficiently support that amount. Under Conservation Planning and Zoning, they did have carryover funds of just under 1.4 million, which can kind of sometimes skew the numbers a little bit because those percentages are based off of the total budget. But overall, they do have a capital outlay that will be reclassed to special services. So if you see that line there that looks a little strange, that will be reclassed. That is their Ascent subscription for their land records. So when you go on to the county website to look at property tax records, that's the program that got coded there, which will be moved. Carryover amounts that are in 2026, so that need to be taken from that fund and moved over, is $1,053,880. A substantial amount of those were carried over from the prior year. A lot of that is like environmental impact funds. They're working on some of those projects. It's easier to track when we have it in each annual budget. Their non-lapsing contingency fund was set at $100,000. I don't believe that they'll have funds to replenish that. That will probably be a multi-year project for them to be able to get up to that non-lapsing account. Under Corporation Counsel, personnel had a vacancy, creating that to be under budget. The special services overage has to do with the social services child support. We do get grant funding from that, so that's our way of maximizing it. There is a revenue that will be recorded in the top part for intergovernmental revenue that has not been yet recorded. The other thing that's not yet in there is $102,187 for our Central Healthcare Corporation Counsel services. County Board, there is no anticipated changes there. In the county clerks, under the 46100, that contains the sale of tax deeds. That reconciliation is still happening through the year-end process, so that will change. Making sure that we get the revenue recorded correctly. We'll also have tax deeds that we took, the certificate values that will affect that budget as well. In County Treasurer, in December, we received a TID closure check from the city of Wausau for $257,238, so that's in that other taxes account. We also received unclaimed property from the state of Wisconsin of $222,752. That is a one-time miscellaneous revenue that we did receive. Sales tax is ultimately going to be about $2 million. The sales tax that's in there needs to be $2,147,894 transferred into the debt service. It has been done, but it wasn't reflective of the report that is in your packet. Under the finance department, there is a substantial amount in the intergovernmental revenue account. That is from social services, or a large part of it is from social services indirect costing. It allows them to charge for services or get state reimbursement for it, and then also recoup some of the internal service money. That does need to be allocated out to county administrator, HR, corporation counsel as well. District attorney, in theirs, you'll see a somewhat significant change. They have a Chapter 950, which is their victim witness program. That program used to be recorded in the grants fund, but it was creating some complexity, so we moved it back into the general fund. You'll see an increase in revenue and an increase in expenditures that will offset each other. That'll come through with budget amendment 4. They too had a $10,000 contingency non-lapsing account that they should be able to sufficiently fund this year. Emergency management did have some additional revenues from equipment sales, or otherwise everything else looked pretty common for them. Facilities had a substantial increase in rent, and that's from ADRC facilities. now at the Lakeview campus. Health had some donations that included $24,000 of deferred revenue. When we talk about the term deferred revenue, what it means is it was money from 2024 that was not received within 60 days of the close. So when we have that, in modified accrual, it says that we need to keep it in 25 versus recording it in 24. So there again, it's usually invoices that we're waiting to be paid for. The exception to that in 2025 will be grants. Grant revenues and expenditures will stay in the same period. They do have a couple of reclassing entries in there. There is a substantial amount in office supplies that needs to be recoded to operating supplies. Human Resources had intergovernmental revenues yet to be recorded. Library is completed. They've gone through their board already. They do have carryover funds that will be recorded in 2026. Medical Examiner had $25,000 of carryover funds from 24 into 2025. They are within their approved expenditure budget. Register of Deeds, when you look at theirs, there's something on there called sales and use tax. What's recorded in there is real estate transfer fee. Sheriff's Office, we had some miscellaneous revenues in there, which were again deferred revenue, and some reimbursements from other counties that we had. They had a contingency of $200,000 for the jail and $50,000 special circumstances that they'll be able to sufficiently fund this year. UW Extension was within their budget. They have carryovers that were already budgeted in 2026, but there's no anticipated changes there. Veterans, the remaining is being requested to fund the veterans relief. The contingency of $10,000 will not be fulfilled this year in order to sufficiently fund the veteran relief program. Out of contingency, the amounts that are recorded in there were $109,320 for the homelessness shelter. Support for other agencies, I do have a budget amendment that will come for that. The overage is due to McDevco loan payments that were sitting in the fund balance that just need to be applied into the year. Social improvement funds had a substantial increase to contractual services, but they did have, and that's due to the indirect cost. The indirect cost is based off of our indirect costing allocation plan, which increased because of the new building, so depreciation and things like that had gone up. It is covered by their revenue in their 46600 human services account. In the opioid fund, we received settlement funds of $352,389 this year. We also received, I think it was about $47,000 or $48,000 in interest income. Total cash at the end of 2025 for the opioid fund is about $2.2 million. We're still anticipating $3,489,755 in future settlement payments now through probably the next 10 years. Parks Fund, they did receive additional revenues, some from their programming. For example, their ICE revenue went up $70,000. Their interest revenue also is up to $42,000. Grants Fund, you'll notice that there's a surplus in there of $804,000 or $800 and some $1,000. That is interest that was on the ARPA fund investment portfolio in there. We have almost extinguished all of the ARPA funds, but we still had all of the money in there. That money will be moved into a different fund, but it was recorded in there. Debt service, we do have a non-departmental transfer that we talked about earlier that will be put in there, as well as the interest transfer and the sales tax transfer in there on the revenue side. On the expenditure side, there is an airport debt service payment from November that needs to be reclassed to the airport fund. Once those are completed, we'll have about $100,000 gain in that fund, and that's from the Bug Tussle $50,000, there's two of them, $50,000 payments for the conduit bonding. Capital improvements project still needs to be reconciled. I do plan on bringing another carryover request for the projects that are in progress. And a lot of that's due because the capital projects are multi-year. And we still need to make the CIP transfer to the highway fund. In the landfill, We changed how the DNR fees are being recorded. We have a revenue and expenditures, so you'll see an increase in the revenues and you'll see an increase in the expenditures. Prior to that, they used to be recorded in the liability. My thought is that it truly is an expense of the landfill, so it just puts it in the appropriate place. We still need to record the depreciation and amortization of the landfill and their capital assets. Under the airport, the debt service payment is going to be reclassed there. They're still working on closing out. That will include capital assets and depreciation that still need to be recorded in there. In the highway fund, we have two accounts in there that I just kind of want to point out, and that's the miscellaneous revenue and the allocation charge outs. We charge out allocated costs like personnel get pooled and then charged to their different cost centers so that they can bill it out to the state projects and the county projects and things like that. Those two kind of offset each other, but they both are in there. They still need to receive the CIP fund transfer. They had increased capital outlay, which was approved through committees and boards throughout the year. That included almost $2 million worth of land purchases, and in total, they had $2 million of rolling stock. We had a couple of snowplows that we purchased in the later part of 2025. We're still working on closing that out. It's not uncommon for that still to be in the closeout process at this time. Employee benefits, property insurance fund are two funds that we'll be reviewing. We will still have transactions happening in there that will be more related to some of the bank accounts that are associated with it. And then the last one is ADRC. We've been working with them to help them close out their fund.
All right, are there any questions? So at the end of the day, based upon the preliminary numbers, what are we looking at in terms of a fund balance surplus to carry over into the KIP?
I'd be more prepared to bring that next meeting, only because we haven't touched capital assets yet. Once we kind of get through that exercise and make sure that we got things in the right spot, I'd feel a little bit more comfortable giving a number.
It won't be zero,
I don't believe it's going to be zero.
so that's an improvement. Chair Gibbs.
Thank you, Mr. Chairman. So the one question I have is, I know we record the sale of tax deeded properties in the clerk's budget. Do we also then record the excess that we received on sale and disposition to settle up with the previous owners in a expense account on the clerk's budget?
Yes, so that's part of that reconciliation process that I'm working through right now. The first opportunity that we had was the Schofield mobile home that we recently sold. So we make sure that all of the expenditures are in there, and then any revenue that we get to keep, and then the liability portion that we owe to the previous owner gets put on the balance sheet, so you don't see that in there.
Okay.
But yes, just to make sure that we've got everything in the same program.
Thank you.
Any other questions?
One more question. On the county treasurers, is the excess interest on taxes and penalties, is that related to our tax deeded activities? I guess it's 341,000 more for interest and 400,000 for penalties.
Yes, so that includes both. So when we receive late tax payments that have interest and penalty, they're recorded there. When we sell a property that had interest and penalty, it's also recorded in there. That's the one thing that's not recorded in the tax deed program that gets recorded in the interest and penalty, just to make sure they're in the right revenue account. So we did have, don't quote me on this, but I want to say 30 or 40,000 from the Schofield mobile home that got recorded there for interest and penalty.
Thank you.
So we track it in there for accounting purposes, but for our cost basis, so if we, like, let's take the Schofield Mobile Home Park we had, our costs of delinquent taxes, principal, or the interest and penalty, and then we had the environmental work that we did on the site. So all of that gets lumped together, and we subtract that from the sale price, correct?
Correct. We recoup all of the allowed costs that we can. So
Plus
it
our
is.
fees, plus fees, yes.
Yep. So a majority of those expenditures are kept in the tax deed program, which is under the county clerk cost center right now. The only revenue that we don't record in that program is the interest and penalty because of the revenue program or the revenue codes that was recorded in the treasurer's.
Is there a way for us to track that if we were to look at our total tax delinquent property program?
Yeah, absolutely. What I can do is, because it'll be in the revenue category, just be mindful that when you look in the county clerk budget and you see interest on penalty and interest on taxes, that's what that is in there, but we can keep that all together so then that way we've got an exclusive kind of look at what that tax deed program does.
Other questions? Not, thank you for that update. 2026 year-to-date.
I promise this one will be a lot quicker. So beginning of the year is relatively in line with where I would expect it to be. One of the biggest changes that we'll have to do is because we moved the treasurer's budget to more of an operational and moved a majority of the things that used to be in there into the non-departmental that aren't necessarily tied. There are some things that carried over from last year when we, look at an expense and try to determine where it was put, they just accidentally put it in there. So when you do look in the treasurer budget, there is some contractual services that will be moved over into the non-departmental as well as the some of the revenues there. Other than that, everything is coming along as I would expected. There are some reclasses again. There's one in CPZ for the software that just needs to go into the right account. It got carried over into that capital again. As far as process for 2026, first quarter is slatted to be closed on May 31st. After that, it'll be monthly closeouts. So at the end of June, it'll be April that's closed out. Ultimately, I landed on a 2-month closeout period to make sure that everybody has the opportunity to go in, receive all their bills, make sure they've billed everything, reconciled everything, and that there will be no more transactions in there once we close it out. If there is a cause for it, it's going to be very, very minimal. But it's meant to make sure that we've got accurate and timely reporting. So everybody, once we get through year-end closeout, we'll be working very hard to get that first quarter closed out. And then all of our reports should be about 2 months in arrears to ensure that it's not changing once you've seen it.
And we'll be going to the various standing committees with that information
Correct.
on a regular basis. Thank you. Any questions on 2026 year-to-date? All right, we will move on to the quarterly update from your department.
All right. So we've been really, really busy. I've got an absolutely amazing finance team who's been working hard to get the year closed out and really support the financial function within the county. We recently welcomed a new member as our system financial analyst for payroll and our full staff again since mid-December. Starting last fall, we started working with departments on quarterly closeouts to start getting them kind of preemptively ready for this year when we have hard closeouts. We worked on things like uniformity and countywide training. Some of the trainings that we did were report training that included year-to-date budget training for both financial staff within the county and management. We started kind of doing countywide finance staff meetings where we talked about uniform practices and standards, starting to bring some of the policies and procedures that are coming through so that everybody's following on the same guidance, which should make it a more efficient process in the long term. We've also been working directly with them to close out their grants and ensure proper accounting, review their receivable balances, and work on follow-up. It's helped really clean up a lot of things in the system to make sure that we are being accurate and up to date. The year-end process started back in December and January, where we were heavily involved in payroll year-end closeouts. This included things like W-2s, the one big beautiful bill, no tax on overtime calculations, annual reporting such as WRS and 941s, which is taxes. We processed 1099s, and we really started going through and started combing through departments. Over the next 2 months, we'll continue to close that out. We're working on reconciling the balance sheet accounts. We've also done random cash audits, where I will just show up, have them show me their drawer, compare it to their system that they're receipting in, and then give the results to the administrator. So far, they've all been successful, which is reassuring, but will also help meet one of kind of, I don't want to say it was a deficiency or like a note in the financial statement. It was just an area where we could improve, and we started implementing that. We've got some continued budget meetings with some of the bigger departments to make sure that we're monitoring their budget, that they're understanding it. Those have been going really well and really successful. Things that we're going to be working on over the next couple of months are budget preparations. So we'll be starting on the payroll budget here shortly, as that's one of the biggest impacts for a lot of departments when they're working through their budget. We'll be working on policy and procedure updates. So we have accounts receivable collection and write-off policy that I want to bring forth, fixed assets and capital assets procedure manual, and then essentially working to put all of the financial policies and procedures into one document that can be reviewed annually. We have continued efforts on uniformity across the county, making sure that everybody's kind of treating things the same way. And then again, as I alluded to earlier, the first quarter closeout by May 31st, and then monthly closeouts thereafter.
So have you been tracking the legislation? I know that there were a number of bills that either have passed or are in the process of being reviewed by the governor. Have you tracked any of the potential impacts of those on the county's budget?
Yes, so we've had kind of a couple of things going around SNAP funding, with something somewhat recent that we got word from the state of Wisconsin that they were going to be increasing their amounts. We have a lot of departments that are making sure they're monitoring some of their federal funding, since we had kind of some scares here and there with it. Emergency management wasn't sure whether or not they'd be getting their EPCRA or EMPG grant, which they did get for 2025, which is great. And just making sure that we're being diligent, that we are not budgeting for revenues that we're not going to be getting. There's also some fee increases for correctional care, which we are trying to be proactive on, making sure we got enough in the reserve for social services for their out-of-home placements as well.
Any other questions for the finance director? Go ahead.
Thank you, Mr. Chair. Just a big shout out to Sam. She went through a lot. This was kind of the Sam show. But I want to go back. She referenced that she brought on a new staff person now. So just to put that in context, at the end of the year when everyone gets their W-2s, they were short. And Sam and her team put in a ton of work, and I just want to formally recognize her and her team for that. You can't overstate the amount of work. Just like she said, the big beautiful bill made some pretty substantial changes to how that overtime calculation and what was taxed. She really worked hard to try to keep our staff informed as to what that would look like, doing a lot of manual calculations to make sure the system worked on the back end. And again, all well short. So it has been a bit of I really want to say I'm very proud of the entire team, but certainly of Sam. Staying on top of with the SNAP issue, that'll be at HHS. We're going to have Krista come in and just talk briefly at the next Health and Human Services meeting about that. Again, want to give a shout out to, we've made a lot of changes. Sam has moved through a lot of things, and I can't say enough about the outreach from kind of what we're working towards is centralized finance, mothership finance to the departments, really holding those individual meetings to help people better understand what that looks like. And then the last thing she alluded to was the Department of Social Services and the increase, what we anticipate to be continued increases in placement costs, both on the correctional care side, but also on the child in need of protection or services side. In light of those, we're going to bring forward a recommendation for your consideration to increase the reserve account amount that you established some time ago for social services at $400,000. I haven't landed on a number yet, but again, when you take a look at that section of the budget, Sam has done a nice job of how do we budget tighter but do it intelligently. And I think the way you do that is you budget tighter and you set up the board had the foresight to set up the non-lapsing contingent accounts for a number of departments, so that we have a place to turn without turning to the general fund. But those costs particularly on the correctional care side with the budget last year in the veto, got a little bit of a reprieve, but I think that reprieve is going to go away. The costs for correctional care placements are going to continue to grow, and we want to make sure that, again, $400,000 sounds like it goes a long way, but when you have a single placement of over $250,000 a year, it doesn't go too far. And placements are not a function of budgets, they are a function of what the judge believes is the best placement for a particular kid, whether it's on the correctional side or it's on the child in need of protection or services side. So again, big shout out to Sam and her team over there. I mean, they go right from year-end close into getting ready for audit. We're going to jump into audit here in a minute. So I should have said, went from W-2s and year-end closeout to actually formal year-end closeout, audit, and budget. It's like a sprinting marathon.
Chair Gibbs?
Well, first off, I want to express my sincere thank you to Sam and her department, because some of the lifts that we've seen and some of the improvements that we've seen as far as the reporting back to this committee, as far as timeliness, especially moving up to looking at closing out months and stuff, that's a huge lift, and just a absolute thank you for your leadership and your department for what it's done to be able to provide meaningful information to committees and to the board as it looks at its oversight responsibility. So thank you.
And I too appreciate that attention to the detail in closing out, because we've, in the past, pushed our audit to the point of, let's just say where we were in jeopardy of not getting our audit done in time to comply with state deadlines, and I don't see that as a problem, so we appreciate those efforts. Don't want to get to shared revenue.
Mr. Chair, I also have a comment. I too would like to thank Sam and her team. We have more information than we've ever had, and I appreciate the transparency. Thank you.
So is it time for a performance evaluation? Thank you. Any other questions, comments? If not, we will move on to the update from the county treasurer. Connie.
Thank you, Mr. Chair. The county treasurer has been very active with tax collections and monitoring of tax delinquent parcels. We've had attendance at eviction hearings and sheriff sales, correction of receiving errors that include lottery credits submitted by municipalities, processing tax write-offs for county-owned parcels, communication with county administration regarding tax delinquent parcels and buyback processes. We've been completing year-end procedures to close the 2024 tax year, paid in 2025. The entry of statement of taxes to the Wisconsin Department of Revenue, including corrections from municipal entries and balancing January settlements. Calculation and distribution of February settlement payments for municipalities to pay taxing districts. Processing late tax payments received from municipal treasurers in February and county open to receipt for the 2025 tax year in mid-February. Receipt and reconciliation of settlement payments that were due February 20th. Reporting to the state, including lottery credit reporting, treasurer's final settlement, the PC 501, and assessment files, the XML that were required in March. Preparation of mailing of 1,582 delinquent tax notice letters in March for parcels with no first installment received, including prior delinquent tax years. Currently prepping work for lottery credit payout to municipalities and school districts that is due April 15th. Working with DOR on corrections from municipal filings to DOR versus balancing with the county PC 501, which is the county treasurer's final settlement. That is still in process right now. Entering lottery credit removals and additions for 2026 tax year from the DOR. And we are currently working on setting up education materials for entering and refunding lottery credits with the DOR and receipting during tax collections with municipalities. We are finding lots and lots of errors this year and previous years.
Are there any questions for Connie? I do have a question just following up on our earlier discussion, and, we rely heavily on both the centralized county treasurer's office and then on the municipal treasurers in the towns. And we were just talking about whether or not we could, as a county, do a better job, and I would just ask that maybe over the next few months that we give some consideration for our discussion about, are there some opportunities to use Samantha, Sarah Severson in our county website to collect some of those policies and procedures and make them available. I know that you're working through the County Treasurers Association. We also have tools with the Wisconsin Towns Association, but it seems like on a somewhat regular basis, we have some confusion, and some of that's due to the unfamiliarity of clerks working with things, changes in laws and turnover. But are there some ways that we could provide access to parts of the county's website to be more of a resource for people so that they have a better understanding? I don't need an answer today, but if we could just give some thought to how we might move ahead and try to capture those things, so that if I'm a treasurer, I'm part-time, I'm looking for things, and it would be nice if I had that resource.
I think the most important thing is to have Transcendent involved. So if I had money in my fund, in my budget, we intend to have Transcendent come in for Marathon County in a centralized area, probably at North Central Healthcare in a conference room. We're going to have them go through receipting, how to enter lottery credits. All of this is funneled in Ascent Land Records. So Ascent provides video trainings on how to receipt. They have municipalities pay for support. They have the Fresh Desk option. I send to all municipal treasurers and clerks guided instructions on how to receipt tax payments and lottery credits. Whether or not they look at those videos is up to them. I've always given them updated information. I've always sent them updated emails, and when I need information from them, it is also whether or not they look at them. So I believe, working with my staff, our best option is to get Transcendent, which is Ascent Land Records, to come in and do receipting with them. But the problem is you have to get it as close to that time frame, otherwise they will forget. But that's going to be like November. We have also offered many opportunities for the treasurers to come into our office and receipt, and we haven't had anyone come in. It was I would believe a year ago, we had Town of Hewitt came in. She actually came in the summer and receipted tax payments with us, guiding her, and we gave her some difficult ones, so she was able to maneuver her way through them. But she voluntarily came in, and we gave that option to the treasurers to do this.
Other questions? Not? So we had, if I can just go back, so we had 581 delinquent property notifications?
1,582.
82, okay.
Yeah, that was removing all Marathon County-owned parcels and removing all parcels so we have a lot of issues as well with municipalities receiving tax payments. They're not looking at the first tab on the tax bill, and they're shorting it 80 cents or 50 cents. Once that's shorted and the first installment doesn't match, Ascent Land Records automatically pushes it to be delinquent. So that makes you delinquent through the whole year, which you owe. You don't get the July option. So we went through all of those, took out over, under, out of our account and made those clear so that they could still have the July payment. So that's another thing that we need the municipalities to be looking at. And I'm also looking at having municipalities send receipts to their residents. Because right now we're also getting our phones flooded with them looking for their payments that they've made, but they don't have receipts. So I think that would eliminate a lot of frustration with the residents as well if they receive their receipt. We always give a receipt. Marathon County does.
Can I ask? A question, Connie, and I certainly am not an expert in this area, but you referenced if a tax payment is made and it's short in a very small amount. Do we have a way within Ascent, because our local ordinance, I believe, says if it's a $2 under or overpayment, we can essentially write that off. Is that programmed into Ascent to alleviate the problem you just referenced?
We have to pull them. It doesn't automatically tell us. We actually have to look at those delinquencies and pull those tax receipts and look at them.
And we do that
And do
as
them.
part.
But we are requesting that the municipalities actually look at what they're receiving. So if they can contact their residents, say you're short at 80 cents, some municipalities actually put in that 80 cents or 50 cents to make them whole because they missed the 50 cents. So I mean, Ascent will push it through as delinquent if it's not, if that first installment is not met. And the first installment always includes the cents. The second installment is an even dollar amount because the first installment includes the specials.
But just specifically on I just want to make sure I understand, kind of going back to the chair's point in terms of process. If I live in the town and I make my first installment payment and I actually pay the full, what I believe to be or I'm going to make my first installment and I write it for, instead of $1,000 and $1,002, it's $1,001. I'm delinquent, but do we pull that to say that, okay, as part of your process, you
Yep,
pull
we're
that?
pulling them.
Okay.
Yep, when we run those reports, so when I get the settlements done, there's also another report that the municipalities, I gave them instructions and actually did it on a Word document, highlighting it. There's a report that the municipalities can run that says less than first installment within Ascent. I requested them to be running those when they run their till reports every day. They can see which parcels are not meeting that requirement. So they can actually correct them on the municipality side before it gets to me on the settlement side. They have those instructions to do that, and I've asked them at least probably the last 4 years to be doing that. It is a function in a sense that they can look at that to check to see if the tax that they collected met that first installment. It will tell them what they're short. And then they can actually reach out to that resident. They've reached out, I've had some of them reach out because during the settlement time, they have to sign off on them. Whether or not, okay, yeah, he did short it, or no, we didn't pay it, or what actually happened. We make them sign it and tell us what happened. Then we will go and talk with the resident and try to find their address and, their phone number to try to talk to them. But a lot of municipalities do, when we tell them, they do reach out and they bring us the 80 cents or $1, or we pull them and take it out of our account to make them whole, because we have an over-under account. Under the $2, anything that's under $2. Anything over the $2, they got the delinquency notice.
Here it goes.
I do know that there was, several municipalities that had contacted me about the lottery credit and the confusion that happened on the lottery credit. And I know we got a notice from the Department of Revenue on several lists of people that had filled out the form for the lottery credit on the Department of Revenue's website, yet there was challenges or misinformation. Is there opportunities to be able to provide clarity around where those challenges came about?
So the Department of Revenue does not accept paper copies. So the municipalities, either they do them or the resident files with the DOR online. Once they get that submission back, they can apply the credit. Lottery credit has always been an issue with the municipalities and how to receive it. They don't understand it. So that's another educational component that we're working on with the DOR to clearly understand what the lottery credit is, how we can help them retain it. If they file after February 3rd, that goes to the Department of Revenue. If they file prior, they can actually apply it during the time of receiving, but they do have to give refunds. Because most of the time they receive the full payment of the first installment, then they have to go back in and reverse that receipt.
But
Give the credit.
but if I understand it correctly, the taxpayer who didn't have lottery credit on their property could fill out the paper copy of the form, hand it to the treasurer, and the treasurer then could input it into the DORs
Correct.
and then still give the taxpayer the credit on their property tax slip.
Correct.
But that was not communicated very well. And that was where I think because I talked to our treasurer and they had some challenges with the communication. So I think there's an opportunity here to be able to provide additional education to the treasurers and so that they understand the true process of the system.
That's why we're working with the DOR. And we're going to be working with them to possibly have a training or at least provide PowerPoint, some kind of way to help them understand what the DOR's process is, because they just changed it that they're not accepting paper copies. So we have to get that submission to the DOR online, regardless if it's the resident doing, the town treasurer, or the county treasurer. But there are other issues with municipalities that we are also dealing with, so.
All right. I think that, again, thank you for the efforts. And, you know, if it's a statewide problem, it would be nice if we could work with the towns, the treasurers, Department of Revenue and others and get those uniform practices out there. And I'm a big, you know, having had problems with the washing machine yesterday and trying to figure out how to correct it and getting directed to all these wrong websites and with limited information. I have a fresh appreciation for accurate information in a certain place. And I think it would, if we can do that in the county's website, that would be great for the treasurers or the towns. But just on a long-term goal, look for that. But, and appreciate the efforts to try to address this prospectively.
I also want to let you know that when we give them information, like to complete their statement of taxes, we give them the summary of taxes. They basically take that summary, they have to go to the DOR's website, put the numbers in, and they have to balance to us. I reiterate that many times, that they must balance, and a lot of them are not balancing. That's one issue we have. And I just want to reiterate as well that for the lottery credit, we gave them a notice in with their taxes when they collected them, when they came and picked up their tax bills. We gave them the process of the lottery credit. So how a person can apply, when to apply, and who applies, and that you can only have one homestead. You can't have it on your rental properties. You can only have it on the property that you live in. We did put an insert in there with it as well. So just letting you know, that's an added feature that we did the last 2 years.
Other Supervisor Limerick.
Thank you, Chair Robinson. Connie, you said we had 1,582 delinquencies. How does that compare with, say, previous years? Can you tell me, is
Yeah, that's about the same. I mean, we, like last year, like 1,400. We look at those diligently before we send them out to make sure that they're accurate. And a lot of the times, it's errors based on municipalities, based on when they received them. We've got a whole handful right now. We keep receiving them. As people are looking at their mail, they're looking at the delinquent notices, and it's a lot of receiving errors. So a lot of our issues are learning how to receipt.
So you're not seeing us trending up on people struggling to pay their taxes and?
Yep, they're still struggling. We have some that, I mean, we still got the delinquency on there. So if they didn't pay 2025, so this actually pulls everybody who didn't pay 2025. It's not everybody in the county that's delinquent. We may have delinquency, but they actually paid 2025 first installment. Those letters are not in there. But the ones that haven't paid 2025 at all or are short, they all received it, but those letters also include the back years of delinquency. And yes, there's still a lot of people that are struggling. There's family issues, there's health issues. They come to us, at least they're talking to us. We're telling them the process. We're telling them that we need to find a way to get this paid for, what's going to happen to my property. We're very diligent with our residents, and they do understand. But a lot of the times, getting those letters too, we're finding errors based on the municipality receipting. And it's important that we get that information, but we also make municipality pull the envelopes. Like, what happened? Did you miss something? We've had some that gave refunds that weren't supposed to give refunds because the check amount was that dollar amount. So,
I guess I'm just trying to connect dots. I serve on several housing insecurity task forces, whatever, and I'm just trying to get a number or a handle on poverty, and if you're seeing increases in that. And then if you are, what do you advise somebody who comes to you and says, listen, I'm tapped out? What are the recourses that people have?
so Erica just sent me a message that we got 1,786 delinquent notices last year. We have 1,582 this year. So it is decreasing from last year to this year. But when we have residents come to us, we indicate, like, do you have family members that can help you pay? Anybody can pay anybody's taxes. If you make an agreement with somebody that's internal, that's up to you guys. But the ultimate goal is to have those taxes paid because you're getting in the interest and penalty. We kind of ask if you're able to get a loan. There are some charities that come out and they can we help you? We do send veterans to the veterans office and they could try to help them. Those are really our only resources. But they do ask for payment agreements. We don't offer those anymore, but we do request it. Pay us what you can, but be consistent. Talk with us. We're telling you where you are. We give you receipts. You need to come talk to us. Tell us what you need, what your struggles are, and we try to find ways to help them. We reach out to people. We try to find ways, but there isn't a lot out there for us to go after to help them.
So when you say that you used to offer payment and you don't do that anymore, is that an internal policy that changed, or was that statutory?
I think it was with administration's agreement that we're not doing that because the majority of the payment agreements we had were NSF checks. We didn't receive payments when they were supposed to. They signed the contract, didn't pay for 3-4 months. Then that's void. Plus, they also have to keep their current taxes current, and that wasn't being satisfied. So we had, when I started as treasurer, we had like 46, I would say about 46 of them. Probably more than half of them were already faulted on that agreement. They weren't paying anything. So then I had my staff, I had my deputy go through all of them, and we gave notices that you're no longer on their agreement. So as of right now, there is only one person that is grandfathered in, and he pays us religiously every month.
And then
So-
you also mentioned you've been going to some evictions. Do you keep data on how many, and is that trending up, down, or staying the same? And are these evictions taking people out of homes, and if so, where are they going?
Yeah, we go to the hearings to see what's happening, and I mean, they've talked to the judges, they try to figure out what to do, but ultimately some are denied, so that they will be evicted, but they are given the process of what happens. So they just don't have the money, or they eventually come up with the money. They're all different.
And so again, are you keeping data on that, or is that not your role to keep
That's not
that
my role
data?
to keep. We just go to them to see what's happening with the parcels, so, yeah.
Administrator Leonard.
Just to build some context, I think, to your two last questions. Relative to payment agreements, I think the intent sounds good, payment agreement, sounds like a great thing for the landowner. In practice, what that does, and this committee had seen that a couple of years ago, is it dramatically increases through interest and penalties, it's eating away at the equity that individual has in that home pretty rapidly because the interest rate, what is the interest rate? It's like 18%, right? Because they have to keep the current taxes current and pay off, and they get on a payment plan for back taxes. What I think our new process has assisted people with is confronting, at least in some instances, a painful scenario, but confronting it earlier. Like, is this current housing option sustainable long-term? If the answer is yes, if you get a loan to pay off the back, more people are doing that. More people are addressing the problem earlier without the payment agreement, which essentially elongates a decision that quite honestly should be made much more expeditiously. The evictions Connie's referencing are the evictions in connection with our county-based efforts to address the tax delinquent parcels. So through that process, again, under ordinance section 3.20, it's a long, Kim and I just met on it briefly before this meeting. It is a complicated process, even far more complicated than I thought when we started this whole effort. And the last part of that is if the individual is still in the home, it goes through court for an eviction process. So RIA from my office attends, Corporation Counsel's office attends, and the Treasurer's office attends. Ultimately, that's the court side of how much time do you have to move out. It overlays within the statutory process under Chapter 75 about the ability of a current landowner that resides within the home. They have the statutory right to repurchase if they do a number of things. So it's a much more complex process, and it's not just general evictions. General evictions are things that are handled through a different area within the courts. That's generally speaking, the small claims sort of process for those evictions, and we have a mediation program to try to keep evictions off of people's records. Most of our eviction cases, and I don't know, Brian, if you're on top of this, but the reports I'm getting from my staff are that the court is inquiring, how much time do you need? Are you going to repurchase? And it's a very, collaborative is probably overstating the collaboration, but it's certainly not adversarial. The county wants you out next week. It's what is the direction this is going? Is it a repurchase? All right, when are you going to repurchase it by? Set it over until that date. If the people know it's not going to be a repurchase, well, how long do you need to get this stuff out? But there have not been a large number of, it's not like we've had 40 evictions. So I hope that, just to clarify, it's not the general evictions. This is the ones in connection with the county moving forward with addressing the tax delinquent parcels. I would say with respect to the number of tax delinquencies, I haven't seen an uptick looking at the counter book report frequently. Like Connie said, last year maybe was a little higher. It's functionally the same. I think to your question, that's not a scientific measure. It's just, in the same ballpark. It's not as though we're seeing a significant increase in the number of those. We are seeing a significant increase in the number of people that are paying, which is good. And a lot of that is due to specifically reaching out. The next batch, I just got an email during this meeting about the next batch of properties that are going to go through to try to address that backlog. The actual phone call of reaching out to the landowner and saying, hey, you're $25 delinquent 3 years ago. We could move forward with an in rem action. Like, we don't want to do that. They just need to pay. It's the situation that Connie's referencing. So that's more than you wanted, but I just wanted to give that extra clarification on what are the payment agreements and what does our eviction process look like.
Thanks, that's helpful.
I'd just like to do a recognition of the efforts that have gone in to try to deal with tax delinquency. And I had a constituent who we kept kicking the can down the road, and to the point where he had no equity in his home because we were slow in starting the the tax deed process. We have accelerated that, and the advantage is you're seeing that, and I think Councilman Connie in her office, we're working with those landowners to get them back in the ownership mode when there's equity in the home. And we are not a good bank. We're a terrible bank. Our usury rates are high. People should not be carrying delinquent property taxes on their record. It's not beneficial to them. And these efforts accelerate that process and actually protect the equity that that person has in the home, which allows them to go out and refinance it and keep it in. And there's a lot of work to that, and we thank you for those efforts. And I just think that we are in a much better position today than we were 3 years ago. And that's the administration, all parties, have been involved in Corp Council, the clerk, the treasurer, and others, but it's been an effort, and I think it's paid off for the county and paid off, more importantly, for many of those homeowners.
I just want to say too that during tax time, we've given them a report of who delinquent parcels are when they're doing tax collections. We're asking that, because municipalities cannot collect delinquency. So if they decide to pay their 2025 taxes to the municipality, can't deny the payment, but they can suggest, go to the county treasurer's office because you do have delinquent taxes. They know their residents more than we do, so we're asking the county board, I give the report to the clerk and the treasurer, asking that they give it to their board to go over these and talk to their residents, because one of them may know who they are. Tell them, hey, you need to pay your taxes or the county could take it. So that's also an effort, and I do have some municipalities that are active on that and actually replying. So that's also another thing that we're doing, so.
Anything else? Not, thank you for the update. All right, announcements. We will have one more meeting of this session of the county board on April 8th. Before the new board takes office. Are there any ideas that you'd like to have discussed at that meeting? I'm sure we will have some cleanup items. If not, that would take us to item 9. What are your wishes? Supervisor Hart moves to adjourn. Is there Supervisor Poole seconds? Did I hear that right?
Absolutely.
All right, all those in favor of adjournment will signify by saying aye.
Aye.
Opposed, no.